Hey future doctors, have you ever wondered seeing neonatals coming to ophthalmology department? So that is majorly due to two reasons. First one is congenital cataract or congenital glaucoma. So in this video we are going to discuss about congenital glaucoma, which is also called as developmental glaucoma. Welcome back to our channel Teddy Gets You. This is Harshita. So what is the proper definition here? So it is a group of disorders in which you will see high intraocular pressure due to abnormal angle development in the anterior chamber obstructing aqueous humor drainage. So there is increase in the intraocular pressure. The intraocular pressure is due to abnormal angle development in the anterior chamber. Because of this angle defect, the aqueous humor is not draining outside through the trabecular meshwork or uveoscleral drainage. So because of that, the condition congenital glaucoma is taking place. So what is the etiology here? Why does it happen? The primary cause is direct damage. So here there is raised intraocular pressure which keeps pressure on lamina cribrosa, which leads to axonal damage and blood flow reduction. Second one is pressure independent. Here you won't see involvement of intraocular pressure. Even without high intraocular pressure, poor blood supply to the optic nerve, which leads to damage. So these are the important points. And vascular factors are autoregulation failure, means there is poor blood supply to optic nerve. Second one, vasospasm. It is mostly seen in migraine and Raynaud phenomenon. Third one is low blood pressure. And there are other factors also which leads to this damage. So the pathogenesis is trabecular dysgenesis, means there is defect in the outflow of aqueous humor. It leads to raised intraocular pressure and eye enlargement. Here you will also see iris insertion issues like flat insertion, concave insertions, etc. So these are the pathogenesis that you must remember. Next one, types of congenital glaucoma. It is divided based on age. For example, newborn glaucoma at birth, and you will see ophthalmos like eye enlargement. Second one, infantile glaucoma before 3 years and juvenile glaucoma after 3 years but before adulthood. Okay? And clinical features you will see classic triad like lacrimation, photophobia and blepharospasm. And corneal signs are corneal edema. It is the first sign and causes photophobia, and corneal enlargement and Habs striae can be seen. This Habs striae is seen due to the breakdown of descent membrane. This descent membrane is one of the layer of cornea, mostly innermost layer. And other signs are blue sclera, deep anterior chamber, lens changes, optic disc cupping, and axial myopia due to increased axial length, and you will also see ophthalmos, which is large eye during birth. So these are the clinical features that you must remember here. Next one is how are you going to diagnose this or examination. Examination is done under the anesthesia in infants. So here you will see IOP measurements, measuring corneal diameter, and as usual slit lamp or ophthalmoscopy and gonioscopy can also be done to check trabecular dysgenesis. Okay. Next one is what is the secondary developmental glaucomas here. So they are associated ocular anomalies like aniridia, Axfield-Rieger syndrome and Peters anomaly, and associated systemic anomalies are chromosomal disorders like trisomy 13, 18, 21 and Turner syndrome, ectopia lentis syndromes seen in Marfan's, etc. and phacomatosis Stretch-Weber and metabolic syndromes also associated here. So what is the differential diagnosis here? Here due to corneal cloudy can be takes place by trauma, mucopolysaccharides or corneal dysfunction. Large cornea may be due to megalocornea or high myopia or sclerocornea. And lacrimation. Photophobia can be due to uveitis or keratitis. And raised intraocular pressure may be due to retinoblastoma, rubella, aniridia, etc. So what is the treatment? Treatment is very easy. First one is you will see beta blockers, which is the first choice. Second one, carbonic anhydrase inhibitors. It lowers the IOP. And hyperosmotic agents for emergency. And the important point is myotics should not be used here. And brimonidine is also contraindicatory because it leads to CNS depression in kids. And surgical treatment are angle surgery, filtration surgery, and glaucoma drainage devices. So these are the surgeries that you must remember here. Okay. So the mnemonic that you must remember here is congenital glaucoma. C for cloudy cornea, O for overgrown eyeball, which is also called as ophthalmos, N for nerve damage, G for gonioscopy shows trabecular dysgenesis, E for excessive tearing, N for nighttime BP, I for infantile onset is common, T for timula, which is a first line drug, A for autosomal recessive, L for lens can subluxate posteriorly, G for goniotomy, L for large cornea which is greater than 13 mm, and A for angle surgery is the first line treatment, U for unilateral or bilateral involvement, C for corneal clouding, O for optic nerve cupping or atrophy, M for myopia, and A for autosomal dominant in juvenile primary open angle glaucoma. So these are the important points and the mnemonic that you must need to know about congenital glaucoma. Hope this video helpful. Consider subscribing to the channel Teddy Gets You for more interesting medical videos like this. This is Harshita signing off. Thank you so much.